There is an increasing number of presentations, communications on what you just call the small, smart molecules in the treatment, particular treatment of lymphoma. That's my piece of cake, Hodgkin, non-Hodgkin lymphomas. And well, those were developed by molecular biologists that have taught to us what the pathways are in a cancer cell through which the cell keeps proliferating. And the next step was that they developed small molecules to block those pathways through which the cancer cells got no signals and were destined to die. And these are now being brought into the clinic one after the other, many times in oral formulation. Just take a tablet, which is of course much more easy than having to come in the hospital, getting infusions or injections. But the major thing is that they are quite active in heavily pretreated patients that gone through the regular chemotherapy treatment, then relapsed again, and not much was left to provide them. And then these small molecules, that's where it all starts in the phase 1 studies in heavily pretreated patients, showed significant activity that was lasting. Not curing patients, but lasting. And the second part of it is that the toxicity profile is quite acceptable. Nothing compared to aggressive chemotherapy. And there are a number of those compounds out there now in phase 1, phase 2 studies, even in phase 3 studies, combining them with chemotherapy to make the whole regimen more effective. And it's a fascinating time. They have not replaced chemotherapy so far, but the expectation is, that's my own expectation, it will not be ready the day after tomorrow. Expectation is that we step by step can get rid of the toxic systemic chemotherapy that doesn't only hit the cancer cell but also the normal tissues. Patients know all about that. Loss of hair, fertility, diarrhea, nausea, you name it. And when we can get rid step by step, can get rid of those aggressive treatments and replace them by the more targeted treatments, the personalized medicine approach, where we don't hit the whole body, but we specifically hit the cancer cells based on the knowledge we have obtained, then we will start to see a completely different picture. In terms of targeted treatment, one of the other developments, apart from the small signal inhibition molecules, where again there is a struggle between the molecular biologists and the cancer cell, because the molecular biologists have developed those small molecules to block one pathway, but then the cancer cell is clever and goes to another bypass, so then you have to produce another molecule. So we start to see combination of those molecules to be taken by the patients to really surprise the cancer cell that is with it back against the wall. But that's a continuous struggle that the molecular biologists will win at the end. Another approach of targeted treatment is with antibody-drug conjugates, as we call them, a difficult word, but the antibody part of that complex is directed against the cancer cell. For instance, in Hodgkin lymphoma, they have CD30 on their surface, that's a sort of protein. The antibody is anti-CD30, so if you inject it, the whole complex, it will specifically bind to the Hodgkin cell, not to other cells in the body. And that antibody has attached to it with a strong linker cytostatic agents, so a drug against the cancer cell. And what the Hodgkin cell in this example does, stupid, it takes the whole complex inside the cell and like a sort of Trojan horse, because as soon as the complex is inside the cell, the Hodgkin cell will degrade and split off the cytotoxic molecules from the antibody. The cytotoxic molecules have free play, they kill the Hodgkin cell. So this is also a fantastic engineered approach to specifically kill the Hodgkin cells, making use of the mechanism that it takes in everything that binds to CD30 on the surface. And that has shown in a heavily pretreated patient with Hodgkin lymphoma and some forms of non-Hodgkin lymphoma, has induced 70–80% remissions in patients that had been treated heavily before and were refractory to chemotherapy.